Hi, Assalamualaikum everybody, and a very good afternoon. Today I'm, as usual, or maybe I probably missed a few weeks, but having said that, I'm here again, Dr. Shasa Aziz from Ear-to-Stick Hearing and Balance Center. Hari ni, we have a very special guest from University Kebangsaan Malaysia, UKM, and a very dear friend of mine, and also someone who I really respect in the world of vestibular. So one of my favorite subject in audiology. So before I invite my very dearest, super awesome, amazing Dr. Haniza, Abdul Wahad, our guest for today. Let me introduce everybody a little bit about her. A little bit, I would say an understatement because she is so amazing. So here goes. Dr. Nor Haniza Abdul Wahad, head of UKM Audiology Program, earned her Bachelor of Audiology with honors from UKM Malaysia in 2001. So she also had her master's in audiological sciences from University of Southampton, United Kingdom in 2003. Oh, not so, actually we didn't never cross paths, Dr. Haniza, but having said that, and received her PhD specializing in vestibular diagnosis from the University of Western Australia in 2011. Definitely have been everywhere in the world for just audiology, huh? Okay, she completed her research and clinical fellowship attachment at the Royal Prince Alfred Hospital, University of Sydney. She also completed a pediatric vestibular clinical attachment at the Hospital Robert Debris, Paris in 2018 and late 2019 after receiving her scholarship for senior researcher by Ministry of Europe and Foreign Affairs, France Republic. Her research interest covers subjective and objective vestibular assessments and management both in adults and pediatrics. Who would be the best person to ask about vestibular pediatrics, if not Dr. Haniza? Definitely. Okay, let's go into her bit of her past research. So Dr. Haniza's past researches focused on assessing the vestibular and balance status in post-chemotherapy pediatric patients and diabetic adult patients. So currently, for adults, she is researching vestibular and balance function in ischemic stroke and patients with obstructive sleep apnea. While for the pediatric population, she is actively exploring the prevalence of vestibular and balance problems in pediatric patients from different continents. Now, other than that, she is conducting studies on employability and communications related issues in deaf population. So Dr. Haniza is responsible for establishing and managing the Vestibular and Balance Clinic in UKM. And she has received trainees among ORL specialists and senior audiologists from Malaysia and Southeast Asia who came for vestibular and balance attachments in the clinic. So she also appointed as the faculty member of Avisa International, an online learning platform for vestibular and balance expert. Hence, as I was saying, who would be the best person to talk about vestibular if not Dr. Haniza herself? Okay, let's not waste time or me talking. Let's get Dr. Haniza on board. Assalamualaikum, Dr. Haniza.
Assalamualaikum warahmatullah. Hi, doctor. How are you?
Fine, thank you. How are you, Dr. Haniza?
Good, thank you. Alhamdulillah. Thank you for having me.
Have you had your lunch?
Yes.
So let me just ask everyone here, have you had your lunch? So if you have had your lunch, maybe you want to put down there what you had for lunch just to, start this conversation. As I was telling Dr. Nor Haniza, hari ni kita tak payah terlampau serious because normally, in most occasions, if you see Dr. Haniza or myself when we talk about vestibular, it's always about the serious part of vestibular, kan Dr. Haniza?
Yes.
So
today we're just going to be different. We're just going to relax and chill.
Correct. So we're just gonna, maybe not too relaxed, but we're going to answer questions. If you have any questions about, if you are parents who are going to have your children implanted, you can ask questions about that. And if you are professionals, which is I think majority of you guys yang register hari ni are mostly audiologists and professionals. So if you guys also have questions, just ask. Dr. Haniza, okay? Boleh? Apa saja soalan?
No worries.
Because macam on my side kan Dr. Niza, kita baru dah 2 tahun kita start Cochlear Implant punya program. Yang orang kata seriously, we've seen Cochlear Implant in general, but this is the time that we really go into deep, and now we have pediatric cases, and it is so wide ranges of pediatric cases, and they are always different. Now, before you answer all of my questions, let's just say hi to everyone who said hi. So we have Tohira. Hi, Tohe. Okay, I think Tohe is one of our audiologists in EATC that is really into vestibular and also into cochlear implant. So mungkin dia pun ada soalan-soalan, tak tahu macam mana. And we have Aries Chan. Good evening, Aries Chan.
Good evening.
Good evening. And sambil makan lunch Okay, bagus. Hopefully makan lunch tu makin pandai gitu dengan belajar.
Jangan tidur dah sebab kenyang.
Itulah Sal. Okay, Dr. Niza, mungkin ada tak apa-apa yang I missed when I was introducing you? Do you want to add any more? Because maybe you have anything, a latest skill that you're doing right now with vestibular, or anything in audiology?
No, I think that's just very good. Thank you.
I think that is,
You're just a kind introduction, I would say.
Okay, I would say that that's amazing. That's all I can say. So we also have Afiq here. Waalaikumsalam, Afiq. Okay.
Salam.
Alright, Dr. Niza, mungkin you want to start with like simple things lah. Macam my first question would be like, kenapa penting kita kena buat vestibular assessment when it comes to cochlear implant, for all cochlear implant users, tak kisahlah pediatrics ke, adults ke, kenapa kita kena buat vestibular assessment? Sebab rasanya if we look at all the past cases, I don't think people even consider the assessment of vestibular for patients who are undergoing cochlear implant. So why is that?
All right. Okay. Thank you for the questions. If you are looking at our countries, in Malaysia, I don't think that any of centers except for UKM is actually looking at making compulsory to integrate the vestibular assessment pre and post implant. But for our UKM team, in UKM, we have to make it compulsory starting from last year, I would say, especially
how so last year meaning, is it like early last year ke, late last year ke?
Early last year. We have been doing it for quite some years. I've been doing it for quite some years, but it's make it compulsory in the protocol, in UKM protocol. The updated version was published last year. Mid last year. So now we as a team has made it like compulsory to do the assessment pre and post implant in PM. Having said that, actually, I believe that European region actually has, and also Australia, have pioneered this to make it compulsory. Most of European countries, like my teacher in Paris, Prof. Waina Baker, she has made it compulsory to assess pediatric adults pre and post implants because there are implications, the scientific implications of doing so. So if you can just share the pictures or the diagrams of the ear to the audience.
Sure, there you go.
So if you can see, because I'm explaining this because I know that our dear audiologists, just like kacang je, gambar ni senang je kan, nothing new. But we're just sharing also for parents later if they happen to view this, right, in your channel. So our ear, telinga kita ni, we are divided into three: the outer part, the inner middle ear, or the middle part, bahagian tengah, and also the inner part. So having said that, yang biasa kita lihat, yang we normally see is the outer part, the pinna, cuping telinga kan, and then followed by the ear canal, which is sadua telinga, and it ends at the tympanic membrane ataupun the gendang telinga di hujung tu, at the end there. And it comes to the most important part where it gives meaning to what we hear daily is our cochlea, sesiput, the snail-like structures that be pointing there. And just next to it, very near, housed with the same cavity, housed with the same, call it a room, maybe a space, is actually the semicircular canals. The three semi-loop structures looking, beautiful there. And also don't forget, we have two really small structures, otolith organs, which, is not really there. We can't really see it because it's embedded inside those, in between the cochlea, just below the semicircular canals, in those areas. So the three semicircular canals, the three loops there that we're looking at, and the otolith organs, separately called the utricle and saccule, actually help in the body balance. So because of the nearness, terlampau dekat sangat, the anatomical structures of the hearing organs, which is the cochlea, and the vestibular organs, which is our body balance organs, in the same cavity, in the same area, they're sharing same perilymphatic fluid of the body, okay? And also the nerve, the eighth cranial nerve, which innervates the same, we are sharing the same nerve as well. So it is very, very important for any hearing loss, or for that individuals to also be, assessed for vestibular, especially when they want to undergo cochlear implantation. Yeah, that's the introduction. I would say it's a bit long.
So basically, the importance of this assessment is because of the nearness of the anatomy. Betul Dr. Haniza?
Yeah, yeah.
Okay, I answered
Having said
correct.
that, if any pathologies, because they're sharing the same fluid, the same house, same area, so any pathologies that involve the hearing loss, the hearing organs, might also influence the vestibular organs, if you think about it, right? Yeah.
Mhm. Before kita proceed kepada kawan-kawan and my team members and also anyone who's watching right now, please do tag your friends, share this link right now, because I think it's very rare that we get Dr. Haniza with us talking about this. So let's make sure that everybody don't miss it. So yeah, I mean, answering back what you've shared just now, Dr. Haniza, definitely is because of I guess the first answer to the first question would be the nearness of our vestibular system and our hearing organ itself, kan?
Yeah, yeah.
So okay, so again, does this mean okay, actually one of the question is what is the connection between balance system and cochlear implant? So we've talked about the structure, but does that also mean that it has connections between the balance and the cochlear implant? Does it have any connections by any chance in terms of function?
In terms of function, the functionality. So
Mm.
when you say connections, if we want to go back, take a step back, right? For implantees, they have to undergo surgeries. So what happened during the surgeries is the electrodes are being inserted. And where does it be inserted? The electrodes, ni kan for parents is actually just like a wire. Just
Mhm.
imagine having a hanger with a rod of hangers or something being put inside a very tiny hole. So actually the electrodes, the cochlear implant electrodes are being inserted via the third window, the round window. Sorry, via the round window by the surgeon. So anything can just happen while it's penetrating. Yeah, that's it. While it's
Mhm.
penetrating the cochlea, and because of the anatomical structures, the nearness, everything can just, it bypass many things that we can't really see. This is microsurgery. So having said that, that's why we have recommended make it compulsory to do the assessment before the operation, to record the response that we got there, and to make a comparison after the implantations, after the surgeries. But not immediately after. Normally the time frame that we have is actually about 3 months after the surgeries. Yeah.
Ni apa Ashikin cakap teringat zaman belajar dengan Dr. Haniza dulu.
Oh, okay. Alhamdulillah ingat lagi, Ashikin. I'm happy to hear that.
Okay. So I obviously every time we have a cochlear implant patients, we actually have we spend our time in the OT with the patients, and I always nervous sangat when it comes to like when they are drilling, and it's so interesting that the anatomy that when you are actually drilling, you actually very near to the semicircular canal. So I think not many people know that. And to me is a scary part, but it's so interesting that our surgeons are so skillful that alhamdulillah never had any issues lah. But again, having said that, that's also I guess why it's important to do pre and post vestibular assessment. But again, is it one of the question here is that is it important to do vestibular assessment before cochlear implant? Do you maybe Dr. Haniza boleh elaborate sikit ke pasal the importance of before make a vestibular assessment before cochlear implant?
Okay, before that, because we're saying about the nearness of the canals, semicircular canals, and the hearing organs, don't forget the saccule. Saccule is actually more at stake when it comes to electrode placement. You never
Okay, so
forget. Because it's really tiny and just embedded below there, right? That area.
mm-hmm.
So it's like, So, and obviously because we can see the sacral response later by doing all the objective measures. The
Mm-mm.
audiologists, we know that it's by via VAMPs, right? CVAMPs.
Mm-hmm.
All right. Having said that, is it compulsory or important to do pre-assessment prior to the cochlear implant? I would say yes.
Cuk,
Especially,
mungkin Dr. Niza boleh kita define balik, mungkin setengah orang tak tahu ataupun lupa apakah kegunaan the semicircular canal and also utricle and sacule.
okay. All right. For the semicircular canals, it's actually a for three-dimensional movements. For parents, especially, yeah, for laymen, it's actually when we are moving, you're moving your bodies through the three dimensions, to the x axis, to the y axis, and bending down to the z axis. And also when you are rotating yourself and rolling in beds, for example, all the three and all the movements that your body makes. For more obvious movements, which is the direct linear and linear accelerations, they are, directly involved with the otolith organs and the
So ke
gravity pull.
depan, ke
Gravity is
belakang.
especially the gravity, belakang, atas, bawah, when you are in a lift, elevator, yeah, that's otolith organs. And then the gravity, while we are standing, while we are not floating because of the gravity pull, that's inside the otolith organs. Yeah.
So it's actually
So all these uniqueness of the organs.
two major different
So,
functions kan Dr. Niza? One is for us to do angle
yeah.
and of course
Mm-hmm.
rotation, and the other one is about moving forward, backwards, atas, bawah, meaning us and gravity, right? So okay, a very
Yeah.
cheeky question. I know this is out of the context. So does that mean that our utricle and sacral doesn't work? Or, I mean, doesn't have any function when we are in space? Because there's
Closing
no gravity,
sensation.
right?
If
Macam
you
mana?
having said that, if astronaut coming back kan from space, what will happen? Pernah tengok tak video Dr. Muzaffar dulu bila dia landed, what happened? Dia
Oh,
boleh
tak.
jalan terus ke, like people kena papah dia and just like dia tak boleh nak berjalan pun. We call
Oh,
it
tak
like lembut
tengok.
kaki.
Oh, dia macam nak geli-geli
Yeah.
kaki. Dia macam like web. Macam
Bukan,
dia.
dia tu memang tak ada sensation of, you can tak rasa kaki.
Oh.
Because yang he needs to undergo rehab for quite some time, I would say. Kalau biasa tu yang tu, sebab the brain needs to be taught, relearn.
We
And then
need
the
to find
autodisk
that
can
video.
relearn. Itu. For every astronaut, it's just like that. Because our body, our brains tend to like lupa sekejap the gravity pull, how it reacts with the hair cells and whatnot. Yeah.
So interesting. So that means when we go into space, our otolith organs terus shut down ke? And then macam bukan shut down, dia tak ada input lah kan. So
Dia
kita
tak ada input.
still guna kita punya semicircular canal, betul?
Yes.
Yay, Syazah Aziz 5-10 markah. 5 dah, 5 atau 10. Aduh. Okay. Alright, so to anyone yang attending right now, if you have any questions, please put at the comment. Anyone from YouTube or on Facebook, yeah, please do ask questions. Ini adalah peluang keemasan anda, ya, tuan-tuan dan puan-puan. Okay, Dr. Niza boleh sambung balik the importance of vestibular assessment before cochlear implant.
Okay. So when it comes to cochlear implant, we know that why do we do cochlear implant in the first place? Because of the hearing loss, right? Severe to profound hearing loss kan memang baru kita recommend, okay, you have aided response, not working with hearing aids anymore, not good enough for speech development contohnya kan. So buat cochlear implant. So kalau daripada segi literature kan, for science, prior research has shown various prevalence, I would say 3 to 5%, 8%, but current literature shows up to 70% of profound sensory neural hearing loss ada masalah vestibular.
I see. So for the whole idea is for us to know whether sebenarnya adakah dia betul-betul memang ada ke tidak ada masalah vestibular ni.
Vestibular, yes. And also because we want to know, because when it comes to surgery, anything can happen kan. So we want to record the vestibular performance before anything foreign is being inserted in the ear. So we just do the test, we record, and after the surgery, after 3 months, which is kita allow the ear to really heal from the operations, then we repeat back the same procedures and we just compare the performance, the response of the patients sebelum implant and also after implant.
Does that mean that this is of course applied to adults and pediatrics, right, Dr. Haniza?
Yes, adults and pediatrics.
I see. So and then so basically what I understand here is that 70% daripada orang yang ada masalah severe to profound hearing impairment, kita normally akan ada masalah vestibular disorder.
That's what the literature shows.
Literature shows, okay, all right.
Yeah.
And that also means we have to do post implant. And again, is it really necessary? So for instance, kita dah tahu dia ada vestibular disorder. Is it necessary for us to actually do again after that implant?
I would say it's necessary because the anatomical structures and physiologically it has changed because of the electrode insertion.
I see.
So it's a new what not to say a new. The change of anatomical structure and physiology might have some impact. We don't know. That's why we need to investigate and record.
I find. I mean, in most cases that you see, would there be any difference in terms of pre and post implant? Like macam even a slight difference ke, you know? Because in most cases that I see, I might be very lucky. There's no difference for us. We still do it anyway because we don't want to take the chance, kan? But how about you, Dr. Haniza? From your experience, was there any slight difference? Because in the end of the day, we all know that the brain is so clever that it's able to calibrate itself. But at least we know what's happening before and after, right? But in your experience, ada banyak tak yang macam differences after implant?
Okay, kalau post implant, the protocol is to do 3 months after the implant, and then kita follow up every 3 months for cases yang ada high risk. For example, in children, in syndromic children misalnya, atau people with physical abilities or any under medical conditions lah. Okay. Tapi bagi for non-risk patients, normally when we see first time after implant is 3 months, and then there's nothing like like triggering factors or something that not striking enough for us to see again. Kita tengok 6 months after, and then once everything is subside, the response is stable, then we stop seeing lah. But we may call again another year just to monitor and have a record on the responses. Having said that, for young kids, I have experienced a few actually yang tak ada response for secure, I would say, after immediately 3 months after the implant. It can be unilateral, it can be unilateral or bilateral responses for the CVEMs, for the secure. It's either totally gone or it's like reduced in the amplitude of the response. But as you said, our brain is very clever, especially for young children, kan? They adapt, habituate, adapt. It's like brain ni belajar, kan? Taking over the other side, taking over the stronger side, taking over the response of the weaker side, we say, kan? Simply, kan? So maybe after 6 months tu dia dah ada balik. But bukan ada balik, tak ada juga, tapi it's not giving an impact, obvious impact to the patients. Kita nampak dia berjalan kerja, tak ada masalah macam tu.
But I understand this is the cases yang ada unilateral vestibular disorder, betul? But what if dia ada dua-dua, because maybe dia buat bilateral cochlear implantation. Again, this is very rare, guys. Okay, cochlear implant is quite a good decision, okay? But how would they be able to get back their balance in that case?
I've never seen such cases in UKM yang ada bilateral vestibular hypofunction, I would say. But from my PhD studies years back, back in 2010, where I did a few cases on bilateral acoustic neuroma, vestibular schwannoma, yang ada tumor dekat acoustic nerve, melibatkan vestibular nerve, saraf vestibular and also hearing. Where patients, I made comparison VEMS responses for unilateral neuroma versus bilateral neuroma. Even for bilateral neuroma, we can see that the response, recording response on papers, they're not there. Nil, kosong, tak ada.
Wow.
But they walk. They walk, they cycle even, they even play tennis. How does that happen? After a few months. After a few months with rehab, with exercise, the brain relearned on how to balance back. Because besides the organs that we have been seeing, the thing that I didn't mention just now is actually vestibular is not an independent system. It's heavily relying and working with other two systems, kawan baik dia, which is the eyes, the visual and proprioception or somatosensory, kan, the overall body balance. So the other two, visual and somatosensory, take over the system. It's just how, because if not, to Allah it's just great kan. If not, banyak lah orang yang vegetative lain and not able to,
Betul?
But kalau macam tu, tapi kalau ada masalah kedua-duanya to the extent yang extreme, in challenging situations, for example, in the dark, total darkness, yang visual system kita compromise kan, tak nampak, ataupun in uneven surfaces of ground, yang permukaan yang contohnya kat padang yang ada banyak lubang, ataupun tak, permukaan yang tak rata, where proprioception kita pun being challenged, visual system will be challenged, masa tu akan ada masalah bagi individu yang tak ada visual vestibular system yang bagus lah.
Betul.
Where the real problem comes.
Betul. I think bila kita cakap asal balance ni, dia punya segmen dia besar. It's not just about vestibular system. Dia vestibular, visual, badan kita, neck kita. So I think that one kalau kita cakap, I think lama masa saya terpaksa mencuri Dr. Haniza ni.
Kita buat second segment pula.
Kita buat second segment lah, okay? Alright, so coming back to our main topic, which is actually pre and post cochlear implant. So, okay, sebelum kita sambung, kita ada orang baru yang cakap, hi Dr. Haniza.
Asha from Cambodia ni. She's from Cambodia. She's a UKM alumni, but she's now working in Cambodia.
Wow, we have everywhere in the world. Like you, Dr. Haniza, belajar satu dunia, okay? So, guys, once PKP dah over, let's all continue our jihad in learning. Having said that, so tadi, okay, one of the question here is that will CI affect our balance system as tadi kita cakap the possibilities, but maybe you want to answer, will CI or cochlear implant affect our balance system? Is there any side effect to our balance system post CI?
That's yes and no to that answer.
Okay.
Individualistic.
Okay.
So
okay.
So that's yes and no. So ada yang ada kesan, ada yang tak ada kesan. Ada yang ada kesan, but it's only temporary measures. And as you said, the brain is very clever kan, they habituate. They adapt. But very little, yang tak banyak sangat, I would say, yang ada masalah yang kesan yang chronic, yang persistent, not many.
Betul. I think from my experience, almost 100% of my cases tak ada vestibular impact lah. So I think again, finding the right team of cochlear implant is very important kan, Dr. Haniza? Dia kena ada the whole clinical team. You kena ada the right surgeon, the right audiologist, of course the right, if you have to have the right physio and OT kalau perlu. Tapi insyaAllah kalau the two dah betul, audiologist and ENT tu yang surgeon yang bagus, insyaAllah tak ada masalah kan, Dr. Haniza? Okay, Dr. Haniza, sebelum saya tanya soalan seterusnya, ada satu soalan daripada Afiq. Salam Dr. Haniza, just wondering, is there any restrictions or precaution in cochlear implant for someone who had vestibular dysfunction during pre-cochlear implant assessment? If no, do we need to start rehab immediately or wait for the cochlear implant operations? Thank you.
Okay, what's the first question again? It's just too small.
The first question is, kalau let's say, kecil kan sebab panjang. Okay, the first question is, if let's say, masa pre-assessment of cochlear implant, dia ada vestibular dysfunction, is there any restrictions or precaution in deciding on the the cochlear implant? Sebab dia kata, kalau let's say tak ada restriction or precaution, do we need to do rehab or we can wait for the cochlear implant operation? Okay. Soalan ni juga I nak tanya Afiq, adakah orang ni ada masalah vestibular sebelah atau dua belah? Because I think dua-dua tu berbeza kan, dia punya impact, dia punya decision untuk cochlear implant, betul tak? Cik, saya pula jawab.
Betul. Okay, I jawab dua-dua. I cuba jawab dua-dua untuk bantu Afiq faham ni. Okay, go for it. So, kita fokus kalau ada masalah sebelah kan, unilateral vestibular problem, for example, kalau dah buat pre-assessment. Now, before we decide for implant, of course, the team had decide which ear to implant, because they will go for the worst ear, preserve the better ear kalau natural hearing lost. And then it comes to vestibular assessment. Daripada situ kita determine which one is the vestibular hypofunctions, the weaker side. Because for vestibular, we also want to preserve the better vestibular side. So that's where we weigh. There are cases yang contradict, but very rare.
I always consider this answer as well, because let's say good ear on the right side but bad vestibular on the left side. What's that? Apa dilema? Macam mana? Bagi I itu dilema lah. Apakah jawapan kepada dilema?
It's a dilemma. Kalau European tu kan, kalau I do ask about the dia punya friends lah kan dekat Europe sana tu that more experience audiology, vestibular audiologists, they will try their best to preserve the vestibular side yang
So
better.
I see.
They
So
will take, because they said that with hearing you can help by using the cochlear implants and the hearing aids, but not vestibular. The problem does not happen now if it happens to be like pediatric cases, kan? But it will happen later in life, 50s, 60s. Masalah lebih senang nak jatuh, more fragility, agility, dah kita dah macam compromise the agility of the patient macam tu. That's why. Tapi kalau vestibular dua-dua tak bagus, then obviously doesn't matter which side, kan?
and then
Okay.
the second question is rehabilitation. Would you actually teruskan rehabilitation before cochlear implant ataupun after tu baru start?
I would recommend 3 months after. It's the same. Kenapa kita buat assessment 3 months after? Because we want the ear to settle. Because lepas operation, it's traumatized inside. We cannot see what really happened, kan? Fluids pun is not being settled yet. The perilymphatic fluids pun dah kacau. Kan? Kacau tu kan sebab apa? Contohnya lah the drain kan? Kalau longkang kata sumbat kan, and you buka something, it's just like that. You just need time to settle. The brain needs time to relearn, to understand what's happening, to accept and adapt to the new electrodes, the foreign matters kan inside our head with the system. So biar settle 3 months after, then we just do it.
I have to say that this is a very, very good information. So far, I've never met a patient that has vestibular, like saya tak pernah ada yang ada masalah vestibular pun to begin with. Tapi but I always wonder, kalau let's say one good ear on let's say right side and one bad bad vestibular on the other side, what are your decisions? Because obviously normally kita akan tanya surgeon, but as a professional audiologist, you want to be able to know your answers too supaya you boleh actually tidur malam tu. Because for me it really bugs me, like I really don't like dilemmas, but this is really, really good information. Thank you so much, Dr. Haniza, for answering the question, and thank you, Afiq, for asking that question.
But having said that, if the problem ada beza kan, sometimes when it comes to it's a team decision, kadang-kadang ada perbezaan. If just it doesn't favor our decision, I would say kan, because the surgeon has the final say, of course, because they're doing the surgery. So we need to pay immediate attention to that patient, and also after like 3 months betul-betul memang focus on the rehab and monitor lah, just monitoring.
So kita kena monitor untuk rehab kan?
Just monitor rehab, and also to do vestibular assessment 3 monthly lah sampai dia dah stabilize the response.
So basically after 3 months of cochlear implant, kalau let's say dia punya vestibular system okay, then we can obviously stop. Tak adalah kita sambung buat vestibular assessment. Betul tak Dr. Haniza?
Boleh, tapi one day after tu is good to just repeat macam annual hearing check lah, just like that.
Faham? Oh, okay. I've never thought of doing vestibular renewal assessment. So that is really important to know that actually that's important for cochlear implant recipients. Now, I have another question here is that, okay, let's say lah, orang ni dah pun pakai cochlear implant, but as far as this person remembers, they don't have any vestibular issues lah. Do they actually need to do vestibular assessment just because to know like what the effects of the cochlear implant to their vestibular system? Is there a specific red flags that makes them like, okay, I need to check, you know what, let me just get it done, get myself sorted? Ada tak?
Kalau dia ada access to the assessment, to the professionals, why not? Kalau nak kata red flags tu, kalau suddenly after the implants, dia start mula ada vertigo, dizziness, woozy, lightheadedness, start hearing sounds, tinnitus contohnya, it's good to do the assessment.
So again, kalau macam ada tinnitus, would you?
It's a fine. I recommend to also do vestibular assessment as well.
Oh, okay. So basically, interesting.
Because it shows that the changes happen inside, but we don't know why it happens.
Interesting, because majority of cases post cochlear implant, tinnitus hilang. So in this case, if tinnitus comes, it's a red flag. We should do a just to just to get your mind.
Like headache kan, woozy, dizziness, then that's the red flag as well lah.
Okay. All right. So that answers that question. Okay. So can we still do cochlear implant if the patient has a vestibular or balance disorder?
If you have a choice sometimes we don't have a choice not to, right? Sometimes it just leave us with the choice that you have to do the CI, whether we know that the patients have the vestibular organ. So that's when we decide which year to do the implant. Yeah. Mhm.
Betul, betul.
Because for every medical condition pun, for every kita need to really solve the matter one at a time, layer by layer. We cannot, really, because of this, we need to stop doing this. We cannot do that, right? In our management. Yeah.
And I think coming back to the main objective of Cochlear Implant is to be able to hear and to get back quality of life. So definitely, in whatever ways, I think for us audiologists, will always work towards getting everything done. Kan, Dr.
Right.
Doctor?
Betul. Betul.
So
It's
again,
just it goes beyond hearing. We as
yes,
audiologists we see that hearing is just beyond hearing. It's for life, quality of life.
correct. And
Because we have,
you want to be
sorry?
able to hear. For me personally, I've said this so many times, my jihad or the reason why I'm still an audiologist walaupun saya nak buat semua benda dalam dunia, because I want to make sure that kita boleh dengar, I mean everyone that we touch can hear until the day they die. They can hear their lafaz syahadah. I know this is so deep, right? But this is reason why we become an audiologist. Over lah pula, but that's definitely the reason why.
Keep up the spirit, keep up the good niat, yeah. Betul Sasha, keep up the good niat. Because I think hearing is just goes beyond everything as we know it's life or quality of life. So social well-being, emotional well-being, kan, hidup berkeluarga semua. It's about hearing juga, about communications, kan.
Betul. Okay, so the next question would be, okay, so we're going to go into pediatrics. How would the parents know if their child has a balance problem? Because obviously this is your turf. This pediatrics, everyone. Saja nak bagi tahu, Dr. Haniza memang hebat dengan pediatrics, vestibular. Okay, so we all learn from Dr. Haniza. At least kat Malaysia ni, semua orang kena belajar dengan Dr. Haniza. Okay, sebelum you nak start pediatrics clinic. Okay, alright. So kembali kepada soalan. How would the parents?
Sasha, I think you're just too generous.
I'm just stating the fact. Having said that, how would a parents know if their child has a balance problem or not? So okay. I think this question is good to know, not just for children, parents and the children with cochlear implant or even without cochlear implant.
General, yeah.
General.
So kalau for parents ni, kalau it goes back whether it's congenital, the child born with it, or it's just like comes later, any problem. Same goes with hearing juga, whether it's congenital, it just comes later. So for any family with history of any balance problem, then they have to be extra sensitive, I would say, extra observant towards their children lah. Kan nak tengok, kena observe betul-betul. For anyone yang tak ada family history pun perlu ada observer parents kan nowadays, kena extra, kena banyak perhatikan anak-anak lah. Among the things for children, sometimes they appear to be clumsy, mudah sangat jatuh, sometimes kan, dah sangat, even berlari dekat even surfaces pun, senang nak jatuh. And then sometimes ada anak-anak yang they appear to be tantrum, they appear to be easily angry, tak suka nak pergi shopping complex. I think for the pandemic ni season ni susah sikit nak bagi contoh untuk shopping complex. Tapi kalau in the older norms I would say, kalau kita bawa anak ke shopping complex, it's a busy corridor kan, ramai orang. So that will, for any vestibular problems, kalau ada masalah visual juga yang compromise, busy informations coming in through the eyesight tu akan menyebabkan dia pening, boleh menyebabkan dia pening. So anak-anak kadang-kadang they don't have the vocabulary, they don't have the terms to tell the stories, tak tahu nak complain pun, dia tak tahu benda tu apa, dia thought that it's just normal, so I'm not comfortable, so I cried, I become tantrum, I don't like, tapi tak tahu nak cakap. So satu lagi kadang-kadang ada dalam yang pernah tengok few times ada anak, we ask them to walk, patients lah to walk 1 meter dekat along corridor, dia akan pegang dinding, jalan sikit pegang dinding, jalan sikit pegang dinding, dia nak stabilize diri dia balik. That's how they cope. The children tend to acquire their own coping mechanism. Satu, tu ibu bapa kena tengok. A wide base gate tu memang is obvious lah, jalan yang macam kata wide base kan, kaki dia tu buka sikit, lebar je jalan dia macam tu. So nak stabilize kan, it's what I would think juga yang kita perlu tengok.
I think sorry, I'm actually documenting all of your answers, Dr. Haniza. So I think one of the things that what I saw is, sorry, I think my internet is a little bit slow. Can you still hear me?
Yeah. I can
I'm
hear you, but you have freeze.
Okay, tak apalah, boleh dengar kan? So I
Okay,
continue
okay,
my
dengar.
question. Okay, so my question is, no, my question is basically what I see is that from my point of view, I banyak juga nampak budak.
I cannot hear you anymore. Dengar. You just wait for Sasha to come back, ya. Yang lain dengar tu Sasha tak? Sebab I tak dengar. Just wait for Sasha to come back, ya. Right?
Okay, so sorry about that. My computer got crashed. Clearly dia.
Okay. Dia dah penat dah macam you juga. You might need to work.
Aduh. I'm
Non-stop
sorry
working.
everybody. I'm so sorry everybody. So okay, tadi kita cakap pasal apa Dr. Nisa? The question
Pasal
was
the reflex for parents. Kalau
okay. Maybe you want to start back again with that answer, with that question. I'm so sorry.
Correct.
I was saying, okay, I remember I said about budak-budak cakap sakit perut, which is very common. Yes. I don't know.
Common,
I
betul.
mean, because budak-budak obviously yang ada vertigo, vestibular disorder, diorang obviously sometimes rasa nak muntah and whatnot. I think that's the best that diorang boleh cerita. They have like, sakit perut and whatnot. But yeah, but other than that, that's pretty much what I've seen so far lah. And of course budak-budak macam Dr. Haniza sini cakap lah, macam they don't want to go out, they don't want to socialize. Banyak yang macam tak nak pergi sekolah. So those are the things that as a parent kita tak boleh nak kata ni malas ni tak nak pergi sekolah kan. Tapi mesti
Tapi
ada
ada studio cases juga for among preschool, among schoolers, among primary school, the clever ones, they can just mimic and just pretend that they have any vertigo. But actually when we have done all the objective measures, they're just there's nothing. They're just normal actually. And then we also have experienced 2 cases actually. Before sampai untuk neurology dan sebagainya, takut ingat central kan. It's nothing. But at the end of the day, rupanya ada masalah kan, personal problems with the family that cause the child to react in such a way to get attention from the parents actually. So dia memang mimik dia vertigo problems. Pun ada dua patients.
So that pretty much goes into behavior issues lah kan, Dr. Haniza?
Yes, that's other matters lah.
Betul.
Psychological related, yeah.
Bila jadi parent ni dia macam-macam kita kena consider, macam-macam kita kena tengok. And I think of course from the vestibular point of view, that's definitely one thing that we need to consider. Okay, the next question. Are you okay, Dr. Haniza? Are you tired?
No, I'm okay though.
Yeah, okay, alright. Sikit lagi.
Berkongsi ilmu.
Thank you so much, Dr. Haniza. So we have a little bit more questions for you. Again, so sorry everybody about the drama and of laptop pun penat
Apa?
dulu.
Selingan iklan.
Okay. My next question is, can a GDD child do a cochlear implant kepada just nak say GDD is global delay,
Developmental delay.
uh, global developmental delay. Yeah. So can they actually do cochlear implant?
Alright. Okay, kalau for parents kan, kalau yang first time dengar what is GDD, what is global developmental delay kan. So kalau delay alone is just a delay in one aspect. Contohnya kalau just the term delay kan, developmental delay can just be delayed or a bit late kata dalam motor functions kan, ataupun motor function maksudnya lambat berjalan, lambat crawling, lambat sitting. But at the end of the day, they can still achieve what they should do, but later lah compared to their peers yang sama umur, lambat bercakap. Okay. When it comes to GDD, global development delay, at least delays in two areas of the child development can be like motor delays together with speech delays, for example, but even social or cognitive, yeah. So at least two, we call it GDD lah. Okay. So back to your question, perlu tak ataupun boleh ke tak? My answer is why not? Why not? Because giving a hearing to a child yang memang GDD, kalau it so happen the child have any hearing problems, it's actually giving life to the child. Giving life to the child. Why is life? Hearing is life. To hear, and the brain will work and appreciate and add meaning to your life. Because by hearing, you are what? Giving ways for the child to start to learn to communicate, to appreciate things, to appreciate surroundings. Walaupun kalau ada anak GDD, sometimes they come with syndromic, whatnot kan, many other major medical conditions yang lain, not able to talk, contohnya kan, sometimes just signing, giving cues to parents, but actually to able to hear, then that's life to them. So yeah.
Yeah, like the saying goes.
Always advise parents to go for it.
Sure, like the saying goes, when you can hearing is your relationship between you and human. So
Yes.
having able to hear, it gives more quality, not just quality. I think we always say about qualities, more meaning to life, kan?
Yeah.
Yes.
I've seen kids yang ada multiple disorders, blind, cerebral palsy, blind, and total deaf. Sampai sekarang it just stuck in my head lah, the patients, because she's just unique. Pernah jumpa 2 orang macam tu kat klinik kan. So when we gave last time, fortunately dia bukan profoundly deaf, but moderately severe, so boleh pakai hearing aids. But she's blind and cerebral palsy, yeah.
Blind and cerebral palsy.
Cerebral palsy, yes. So boleh pakaikan hearing aids. First time dengar mak dia bercakap, dia react. Because before that, the mother was saying, she knows my smell. That's when she knows that I'm around here, smell. Sensory. Dia tahu mak dia dekat, dia bau kan mak dia kan. But now bila dia dengar, she knows that I'm here. So the mother was really happy. And that's a way of, interactions. Bermula kat situ lah juga.
I mean, Allah made us so special. We have 7 senses. And I pretty much, because I'm not going more into like children's education and whatnot, and going deeper into like how we learn as a human, because there's 4 types of ways of learning, and then there's 7 senses. I'm like, really, when one goes down, there's something else that you can go into. Macam contohnya, children with cerebral palsy, they cannot, they probably cannot walk, but they can obviously rely on other things. Tak boleh nampak, boleh bau. Tak boleh nampak, tak boleh dengar, boleh bau. Of course, with the new technology, we now have cochlear implants. So definitely, I'm with you. So that means the next question is actually, can a child with cerebral palsy wear cochlear implant? You've already answered that question, Dr. Haniza. Definitely, boleh. Okay, kita ada satu soalan daripada Muzliha, Dr. Haniza. So, hi Dr. Shazan and Dr. Haniza. Tes apa yang kita digunakan untuk vestibular assessment?
Alright. So kalau tes apa yang nak digunakan, panjang juga tu kan nak jawab. It depends on the population that you want to test. Satu, whether adults ataupun children. Kalau children, umur berapa? Infancy, toddler, preschoolers or school children? Okay, 2 benda. And secondly, whether you have access to the equipment or not. whether the center, that you have access to equipment or not. Third, whether you have the professionals to do the testing or not. Okay, kalau we look at the age first of the patients kan, kalau it comes to infancy kan, ada screening, a lot of vestibular screening tests that we have in the market. Sebab we kena belajar lah, acquire lah, we know kan. Even objective measures pun dah ada. Contohnya kita gunakan VHIT, that the synapsis system, the non-goggler system, I think, which is the best I would say lah for very young children up to preschoolers, because dia tak payah guna goggles kan. The goggles, the limit of using the goggles is because of the head size. So audiologists yang biasa guna VHIT dengan goggles tu lah masalahnya. Tapi when it comes to dah fit in nicely with the camera, dah maybe preschoolers, primary school age and above sampai adulthood, elderly, the goggles system works beautifully. Kan, we have a few in the market as well. So that's one.
Yeah.
So kalau tu the simple one, another one is VAM lah. VAM. Kalau VAM, or CVAM and OVAM. Kalau OVAM, 2 years and above, dah boleh faham instructions and whatnot. CVAM is easier. Infants pun boleh dah buat OVAM. CVAM, sorry. Dengan a few modifications lah. Okay, there are modifications. The test is quite similar, I would say, from children and adult, tapi ada special modifications that need to be done for young children. Also, we have a lot the screening one, Romberg, testing Romberg. But in children, I would say the technique is the state of the art, especially testing in children. Kena banyak masa lagi spend, kena banyak sabar. And also you integrate play with children. You can never get a response within 15 minutes, 10 minutes as expects an adult kan. Kadang-kadang in children can prolong sampai 1 jam and then tiba-tiba nangis lapar, so kita sabar. Tak apa, bagi minum dulu. Tak boleh juga, come back a week later. Because I always believe in my community, tak nak our patients to feel traumatized. Tak nak ada negative stigma, tengok klinik, tengok Dr. Haniza dah takut. I don't want that. I'd rather, tak apa, sabar. I spend a bit more time. Datang semula pun boleh. Kalau ada next patient dah kan, kita tak boleh wait. So datang semula next week. That's what I always do. And I always tell parents, you have to be patient lah, sabar.
Yeah, I mean, for us, yes, pediatric is definitely a pediatric assessment in any ways, vestibular ke, hearing ke, you need a lot of patience. And I think for me, when I would say like when you are performing vestibular assessment for pediatrics, you have to be flexible. And you tak boleh sorang-sorang. I don't know how you do it, Dr. Haniza. Are you alone?
I have one Sarah to help me always, or in Cairo. Yeah.
Agrees. I would have Cochlear, and also sometimes I have Fat ataupun Atika to join along, because it's always either from standing to on the bed, on the floor, on the mat. Basically, you just have to be very flexible. But in the end of the day, it will be very fruitful. But you need to do a lot of it. I would have to say with vestibular assessment in pediatrics, it just needs to do a lot of it, and then you'll definitely find the quirks yang sesuai untuk you as a clinician.
Yeah. Find the what?
Find the right quirks. Macam contohnya, find the right method that works for you lah. Because
yes.
to me, vestibular adult assessment is like macam kita, it's just SOP. Pak. That's the answer. Tricks.
No.
Fun.
That's why when you're doing, mulut ni pun bukan bercakap for the children, because children sometimes they cannot understand, but actually you are telling the parents that's what you are doing. It takes time. And they will understand, they can see. Kan? Sometimes and also my advice kan for all young audiologists out there, tak payah tunggu ada alat lengkap baru nak buat. Because as you said earlier, we have been discussing kan, it's very expensive, and with the current economy it's not easy to maintain. Beli purchasing tu satu, nak maintaining pun another issues over years kan. So it's wear and tear, as we know, we need to calibrate, and that's also to cost. My advice is buat screening. Learn. In children we have PCT SIB. For adults we have MCT SIB or CT SIB. Learn about those technique. And if so happen patients yang datang kat you ada masalah from your screening, refer out to any centers yang secondary or tertiary centers yang ada all the equipments, and refer out your patients.
Definitely. I think in the end of the day, we as an audiologist, kalau yang ramai audiologists, our job is to give back quality of life. So let's
Yeah.
work with each other to get there, definitely. And macam Dr. Haniza kata, it is expensive. Equipment memang mahal, tapi kita sebenarnya boleh buat
Mm.
sesuatu. We can start with something to assess.
Simple.
As
Yes.
simple as testing the balance system, I think that would be good. Macam tadi Dr. Haniza kata, CAT-SIP, I call it CAT-SIP, or I'm using
With the
GANS.
cushion. The
Yeah,
cushion. No?
the cushion.
Yeah.
Yeah, as simple as that. So I hope everybody
Betul.
teruja yang dengar ni untuk buat vestibular assessment.
Music cushion, standing test, rumba, sharpen rumba, walking test. It's all
Yeah.
free. It's just like familiarizing and understanding why you're doing it. Itu je.
Betul. Okay, so I'm almost done with my question. It's almost 3:30. Everyone who's watching, please don't forget to put your question in. We have I'm trying my best to curi another 10 minutes of Dr. Haniza's time. Okay, so my next question would be, if the patient has a vestibular issue on one side, which side should be implemented? I think we've kind of answered that, or maybe you want to answer it because we have new eyes here. And is vestibular assessment important in determining the site of implant?
As we have been discussing for the last, I think for the first 30 minutes, I think, right? Whether to decide if there's unilateral vestibulopathy versus bilateral vestibulopathy, and whether there's a cross path between the hearing side versus the better vestibular side. So if you are lucky enough, in most cases, sama je. Hearing is better on the right, vestibular is better on the right as well, because as we have been discussing, we've talked about they're sharing the same house with the same space and very limited weights and whatnot, kan? Tapi sometimes there are cases yang opposite.
Yeah.
Kadang okay, hearing, unfortunately, kiri yang okay, better for vestibular. Ada juga, even though it's very rare. So that's when the two professionals needs to sit in together and also makes the parent understand of the decision being made. If it so happened that the decision to implant is opposite to our favors for the vestibular audiologist, then I said that we need to really closely monitor the patients post-operatively lah.
And I think it's okay to repeat a vestibular assessment because sometimes because I don't know anybody else lah, but sometimes for me macam dah nak buat the first one tu memang ya Allah satu perjuangan, lepas tu macam ada masalah biar betul, lepas tu macam nak alamak dilema pula kan, the other side is a good ear, this side is the one that's not good. You repeat je because in the end of the day
repeat. Yes.
You won't go wrong by repeating, and definitely after that it's just professional decision lah, I guess, as a collective kan. And worst case scenario, get second opinion just to make sure that your results are actually betul-betul negative. Yeah, betul. I have my one last question. Okay. Last question for you, Dr. Haniza, before I let you give your last words of wisdom before our next session. All right, so is there any difference in terms of prognosis and cochlear implant performance between patient with vestibular issues versus patient without vestibular issues after implant?
So there is some different prognosis as well, because sometimes as we said, there's yes and no to the answer to the question. Because sometimes it depends on many factors, the individualistic of the patients, individual, and then the surgeries process that they have to undergo, what happens in between, what happens during the surgery itself, and the reactions to the symptoms of the body. Sometimes the prognosis might be better, nothing. Vestibular problem does not being hindered or is not being touched at all, nothing, no problem at all post implant, but sometimes suddenly it just happened. So that's why it's always like UKM has come to the point of making it like compulsory post implant as well, just to make it. And I think it will be good for other centers to start doing the same, because sometimes in most of our centers, even though they're fully equipped, but their lack of audiologists were able to do it. I always believe that many people can do vestibular testing. It's not something novel. Even if we train our technicians, they can do it. But putting the results together to integrate the results together is the something which it comes with experience and it takes time. So get help from your professional circle, because as Dr. Sasha has been saying, we learn new things every day. We might be confused ourselves. Always seek for second opinion, make a discussions, always ask around, and repeat your assessment if you're not sure. Take your time. Yeah. So prognosis tu boleh pelbagai lah.
Betul-betul, definitely. I think that one is kena orang kata kena buat banyak kali until you are so confident. I think vestibular in general you just have to do over and over until you get there. And I think
tapi as you said kan, Dr. Syahsa tadi kata kalau macam adults, it's just like SOP dia ada. It's like straightforward kan. But sometimes just integrating the results, so sometimes yeah, it's not straightforward. Another thing tadi kita tak sebut kan, we keep on saying that guna ujian apa, test apa sebenarnya. But we forgot one important thing, history taking tau. History taking is very, very important.
Oh, history taking is 80% of our vestibular assessment.
So that's very, very important. And it's free. So, but how do you master, asking the right question? Asking the right question, probing the parents, for example, if you pediatric cases, kalau adults pun kan. So that's how you need to know the background of the case, read the case notes, take your time to think what to ask, look at different angles, don't only look at one particular angle, and try, to look at put yourself in the patient's shoes and see. Sometimes kalau adult pun dia come to trust juga. Sometimes they're not telling, especially in idiopathic cases or pseudo vertigo kan, they're not telling the truth. But after some time of meeting and counselling, they will reveal and we know why they're having all those vertigos. Because nowadays banyak cases yang anxiety related vertigos for adults, especially for children pun. Especially now lah, because of psychological among society banyak kan. Sometimes vertigo, anxiety related vertigos pun semakin banyak sebenarnya.
Oh, this is interesting. Anxiety
related vertigo.
I think from our side, because it's our services are paid, so people who have who maybe pseudo cases not common, but mungkin pediatric ada kita dah jumpa, tapi not for adults. So I think Haniza punya side mungkin akan nampak lebih banyak pseudo cases, which is interesting for me to learn. I mean, coming back to vestibular assessment in general, yes, in adults it's more of an SOP, meaning what we do is just pretty much ABC. But in interpreting, I have to say, every patient is unique. Every patient learn something new. And I always feel that macam contohnya patient ni ada diabetes jenis macam ni. And ada vestibular disorder macam ni. Ada patient yang macam ni, anxiety dia macam ni. And dia ada, yang ini ada tinnitus pula. Yang ini ada drama family issues, ataupun yang ni sebenarnya nak dapat attention dengan suami. It's not impossible to have this kind of issues, but they are real issues. But I always feel that macam patients yang ada vestibular disorder ni mesti ada psychological issues or impact somehow, and dia akan relate dengan semua benda dalam dunia dia yang tengah dia depressed. So in the end of the day, vestibular disorders sangat-sangat related to psychological issues, and I think that as an audiologist kita kena equip dengan masalah yang potensi akan relate to that patient. And of course this one dah lari sikit daripada kita punya perjuangan Cochlear Implant untuk hari ni, but I think it's very important that we
address this and also we educate whoever is listening to the
So macam some audiologists macam want more. I think vestibular disorder punya genre gives you more in terms of the research pasal psychological issues, behavior issues, because macam hearing, not to say tak ada behavior issues, tapi dia kurang lagi lah daripada vestibular issues. And I suka drama dalam hidup ni sebab I rasa macam banyak benda belajar.
So colors your life.
It does. Macam lah drama I tak cukup banyak kan. Saya habis. Okay lah. Okay Dr. Haniza, sebelum kita habis, I ada dua lagi benda yang nak buat. Satu, I nak share dengan semua orang promo yang akan berlaku esok untuk jom ke Barutan. Tapi sebelum tu mungkin Dr. Haniza, your first, last but not least sharing for today. Ada apa-apa tak you want to say?
Thank you. I would like to say thank you to Dr. Sasha, Autistic, for having me. Saya rasa berbesar hati lah to share. I can hopefully have more sessions like this in the future. And then I would like to say, just for audiologists who are listening, challenge yourself. Challenge yourself to explore new things. Because in order to do new things, you kena ada hati yang besar. Macam for example, as you see, Dr. Sasha, she has started her own settings. Ada hati yang besar untuk berbuat demikian. To venture into pediatric contohnya, which is not easy because it takes time and passion, kesabaran kan, passion, kecintaan, passion kan, kecintaan, kesabaran untuk buat tu. So you place yourself in different league actually, tapi at the end of the day berbaloi. Walaupun penat, kaki sakit berdiri lama, letih, but actually you find happiness because you know that you're helping a life, a young life, the family as well. It's really related lah. So kita bersyukur sebenarnya kalau kita berada dalam bidang ni, helping people dengan niat yang betul. Actually we are earning to what we are doing, but at the same time it's ibadah as well.
Betul. Oh my god, I think that's very deep. Kalau I boleh tambah sikit lagi kat situ ialah hopefully yang tengok ni lagi semangat nak buat vestibular because definitely dia berbeza dengan cara kita jumpa patients yang ada hearing impairment, but it comes with a lot of passion. Kena ada kesabaran sebab dia memang kena sabar.
Yes.
Okay, Dr. Haniza jangan lari dulu. Kepada semua yang ada hari ni, as I promised to those yang register, kita akan buat cabutan bertuah as usual. Nothing new about that. So let's watch Jom ke Barat Hutan punya 4th episode. Cepatnya dah 4th episode. Okay. Yeah, and kita dah ada first pemenang hearing aid percuma daripada Autistic dan sponsored by Belton. So let's have a look first.
Minggu ni Uta nak arah Safa dan Adam mencari kawan hutan. Apa lagi? Jom kita jam hutan selalu
Malam ni kita akan tengok satu fenomena klip-klip yang tercantik di Sungai Selangor.
Jom Kembara Hutan setiap Ahad jam 11 pagi hanya di Bananana TV3.
Alright, so basically kita dah episod keempat dah, Jom ke Barat Hutan. Kita ada satu pemenang alat bantu pendengaran secara percuma. Hopefully kita boleh share siapakah pemenangnya in the coming days. And then kita just nak beritahu semua orang kita ada lebih kurang 9 lagi alat bantu dengar to give out, sponsored by Belton, dan kita ada 2 voucher daripada Cochlear Implant, daripada Cochlear, ada RM20,000. RM20,000 untuk giveaway untuk sesiapa. If you guys know anybody who needs this voucher, ask them to watch Kembara Hutan, masuk competition, and then kita akan announce siapa pemenang dia lah. Okay, untuk hari ni kita pun ada pemenang yang datang hari ni. So I just nak tengok nama-nama yang I tak nampak. Sekejap ni. Let me stop sharing and share this one. Sorry everybody, bear with me. Yes. Kita lah. Tada! Okay, kita tengok semua nama ada. I rasa Afiq tak register kan? Okay, I akan masukkan nama-nama yang ada hari ni.
Rudy tak register kan?
Afiq. Siapa lagi yang ada ni? Kita nampak Muzliha. Muzliha pun tak register kan? Okay, nampak masukkan Muzliha.
Sasha baik
ya. Okay, hari ni I buat Umi Asura. So let me see if your name's in here. Okay, please apa nama dia? Please buzz me if I don't know if you guys are in, so that I know you guys are part of the cabutan bertuah. Tak ada benda pun. Korang akan dapat seronok-seronok ni. Umi Asura. Okay, alright. I think I have everybody. And I masuk nama Tohira. And I think that's about it. Am I missing anyone? Zirwa, Siti Aisyah Ahmad. And Zirwa. Okay, a little bit anal there. Nak kena betulkan nama, minta maaf. Okay, I think I've got everybody in. Kenapa tadi nampak nama Chen Angel? Tak cukup dah nama dia. Okay, I think that's about it. So let's have a look. Okay, anda yang menang ni akan mendapat susu daripada Daripada apa nama brand tu Ryan Kids. Let's have a look. Weh, Dr. Niza sikit Weh, Kak Ain. Rafida. Kamardin. I harap she is here. But anyways, thank you everybody for joining this session today. So again, Dr. Niza, ada lagi tak last but not least of sharing? Mungkin ada terlupa ke sebelum kita akhirkan session kita hari ni?
Ada apa? Cuma saya berharap semua kita jaga kesihatan, jaga diri. Hopefully kita terlindung daripada masalah pandemik sekarang ni lah untuk semua, maksud diri saya. Alright, thank you Dr. Sasha again and Eutistic, thank you again. And thank you to all yang mendengar. Harap-harap kita dapat bertemu secara physical later in the future insyaAllah.
Yes, insyaAllah. So mungkin kita akan ada session 2.0. Kita tak tahu, let me think about it. So if you guys have any questions, any topics yang you guys want us to, kupaskan, selalunya session ni sejam je lah. Kita akan santai-santai je. So nak lebih kena bayar lah Dr. Niza ya. Sekian terima kasih. Anyway, thank you so much everybody. Yay, Rafida, congratulations. Okay, again, thank you so much everybody. Thank you so much Dr. Niza for spending your Saturday, valuable 1 hour and a bit for all of us to learn from your very, very, very long history and also long learning journey. Thank you so much and I hope that you will stay safe and definitely dilindungi sepenuhnya keluarga dan juga diri Dr. Haniza dan juga pada semua yang watch hari ini. Thank you so much. Assalamualaikum.
Bye-bye. Bye-bye.
Bye.
Bye.